Welcome to the Dell Financial Services Discovery Health 2022 Plan Update presentation. In this presentation, we will discuss the Discovery Health contribution increases and benefit changes for next year. This presentation is supported by a brief edit of the Discovery Health launch video, as well as plan guides and summaries that are accessible on our website. The link to the video and documentation was included on the email you should have received. Medical scheme contribution increases for each year are calculated after taking into account a number of different factors. These factors are indicated on this slide. Discovery has once again forgone the usual year-end contribution increase and has decided to delay the increase until May of next year. The increase on 1 May 2022 will be 7.9% across all plans, which works out to an effective 5.3% increase for the year. The reason for the delaying the increase was to again provide relief to members placed under financial strain during the lockdowns of this year. As usual, members are able to change plans effective 1 January. We have included a link to a video that provides a more detailed analysis of the breakdown of the reasons for the increase in the mail which you would have received. Increases are based on supply side and provider cost increases and demand side or member utilization changes. You can see a little bit more about these in the video. In assessing the increases required for 2022, Discovery weighed up plan sustainability and client affordability. There were two choices that medical schemes could make. The one was to maintain a systemic inflation matching approach, or they could follow a short-term pricing strategy where they adjust contributions for next year based on suppressed utilization experienced during the COVID-19 waves. These two approaches can be seen on this slide. While COVID hospitalizations increased during the various waves, there was a decrease in the usual elective screening and other procedures. This resulted in a discontinuity on medical scheme claims. The concern with the short-term pricing strategy is that it will require a price shock in the future to get the contributions back in line with medical inflation once things revert back to normal. Discovery decided the systemic approach would be best for scheme sustainability and the clients. Leading on from the mention of the influence of COVID-19 on contribution increases, we felt it important to briefly discuss Discovery Health's findings regarding the vaccine. Discovery Health analysed the 1.2 million members of theirs who have been vaccinated and found high efficacy numbers. The chance of death was reduced by 94%, admission to hospital by 92%, and the chance of infection dropped by 79%. Their analysis also found the vaccine to be very safe. There were no major adverse effects, and for the tiny percent that did experience things like muscle pain, lymph node enlargement, or tingling hands or feet, the issue resolved very quickly without medical intervention. While we may be seeing a low number of cases currently, we need to remain vigilant. There is a risk of a fourth wave, new variants may emerge, and long COVID is an issue. The vaccine is still the most powerful way to restore normalcy. There will be limit changes as well as several benefit enhancements and additions in 2022. There will be a 4.5% increase in co-payments and deductibles, while plans with a threshold benefit will see this increase by 7.9% next year. There will be changes to the chronic medication formulary and drug amounts, which those on chronic medication will be informed of directly. There will be enhancements to the palliative care offering, as well as the trauma extender and oncology innovation benefits, which will now be offered across all plans. The allied therapeutic and psychology extender benefit will be extended to include more conditions. There will be a basic dental trauma benefit, a tonsillitis management program, and an anesthetic preoperative benefit added in 2022. There are some great new innovations coming to Discovery Health in 2022. Foremost among these is the Hospital at Home benefit. For a number of conditions, up to 750 members at a time will be treated in the comfort of their own homes by a team of skilled staff. You can find out more about this benefit on the video clip we embedded on our website. The link, once again, is in the email you would have been sent. All Discovery Health members will now be able to download the Discovery Banking app and access Discovery Pay. This will also give them access to Vitality Travel and Discovery Miles. Discovery is also partnering with My Health Teams, where members with certain conditions can engage with fellow sufferers and experts on a fully moderated platform to share experiences with the various diseases. In the next few slides, we'll provide some detail on the plans Discovery offers across their range. This may help you decide if you're still happy with the plan you're currently on, or perhaps you're considering a plan change and would like an idea of the options available. Remember that you can change your plan at the end of every year. Discovery have a wide range of plans to cater for all medical aid needs, from their income-based key care plans, through the core hospital plans, the savings plans, and finally the comprehensive plans. All Discovery plans offer a comprehensive in-hospital benefit, cover for chronic illness, and screening and prevention benefits. There are differences in the limits, the health rates, and the comprehensiveness of hospital cover, but the primary difference in plans comes when comparing the out-of-hospital or day-to-day cover. We'll go into this in more detail when going through the various plans on the slides to follow. If you'd like to see more details on the plan types, we suggest pausing the presentation. There's also detailed information and summaries of the plan types on the website link that was emailed through to you. Let's start with the entry-level Discovery Health plans and work our way up. The key care plans are income-based plans where the contribution payable is dependent on the earnings of the main member. This allows greater access to medical cover for all individuals. The core key care plan covers you while in hospital, and you will need to self-fund all out-of-hospital expenses. On the Key Care Plus option, you have access to day-to-day cover paid for by the scheme. On both these plans, however, you are required to use designated key care service providers. Once again, information on this is available on our website. The core series of plans only covers you while admitted to hospital. You also get cover for chronic conditions, as well as the screening and prevention benefits. All out-of-hospital day-to-day expenses, however, are for your own account. The Smart series of plans offers cover while in hospital, as well as cost-effective day-to-day cover. However, all of this is provided through a limited smart network of providers. The Saver series offers the same in-hospital cover as the core plans mentioned earlier, but it adds in an annual medical savings component. These savings can be used to fund all out-of-hospital medical expenses. Once these savings are depleted, however, you will need to self-fund these day-to-day expenses. The amount of savings provided is dependent on the plan you choose. The Priority series is similar to the Saver plan in that it covers you in hospital and has a savings component. It then, however, provides you with an above-threshold benefit. Once you have depleted your savings, your day-to-day expenses continue to accumulate towards a threshold level. Once this level is attained, the above-threshold benefit kicks in and your day-to-day expenses are covered by the scheme within certain procedures and overall limits. The comprehensive plans offer the same benefits as the priority plans, but with a higher savings component, a smaller self-payment gap, and no overall threshold limit. A self-payment gap is the difference between the point at which your savings run out and your threshold benefit kicks in. In other words, it is the amount of day-to-day expenses you will need to self-fund before the threshold kicks in. Details of all these plans, their benefits, limits, and contributions are available on our website. We strongly suggest that you read the plan guides to fully understand the cover you have. All health plans across all medical schemes have cover limits and co-payments for certain procedures, sub-limits on some medical devices, and provide cover to a specified health rate percentage. Gap cover is essential to cover these shortfalls in cover while in hospital, which would otherwise be for your account. There are a number of benefits provided by Gap, with the main ones being an increase in your in-hospital cover rate by 500% cover for all co-payments, an increase in certain sub-limits, and an increase in the level of cancer cover provided. There is also an out-of-hospital casualty benefit for qualifying emergencies, as well as a number of other benefits, which can be seen on this slide. The benefits provided are dependent on the gap cover plan you choose. For members on the key care plans, your gap needs differ, as there are a number of medical procedure exclusions specific to these Discovery plans. Vitality is an add-on lifestyle rewards program that you can choose to join. It offers benefits and discounts from a wide range of providers. There have been a number of enhancements to the Vitality offering in 2022, with additional partners added and a number of new benefits. We have provided detailed information on the Vitality offering on the email you should have received. Prices for Vitality have increased for 2022 across the entire range. For those interested in joining Vitality or finding out more about the benefits, please feel free to contact us. There is a great special offer running at the moment where you can join Vitality for free for 3 months. You can also join Virgin Active or Planet Fitness through Vitality and only start paying in 2022. Activation fees have also been waived, so there is no time like the present to start getting active. We thank you for joining us for this presentation and trust this answered many of your questions regarding changes for next year. If there's anything that was not covered that you would like to know about, or if you'd like to discuss plan changes, you're welcome to contact our office on the details provided. Plan option changes should be available from your HR, or there was a link on the email. Thank you once again for your time and for allowing us to look after your medical aid needs.